Joining me now is Githinji Gitahi. He is in Nairobi, Kenya, and he is the CEO of Amref Health Africa, a nonprofit organization dedicated to helping Africans receive much-needed health care. I really thank you for joining us at this hour. How would you grade the world's reaction to this new variant thus far? And I ask because the Africa CDC, and I believe you serve on its board, has been categorical, right? It said that it strongly discourages these travel bans and adds that they've not worked at any other time during this pandemic, and they're not going to work now.
It is extremely frustrating, but not surprising. I think the reaction we see is this is how the world has treated Africa all along. You know, the world locked vaccines from getting to Africa, and now they're locking Africa from accessing the world. It is unfair. It is actually completely unacceptable. And I think that for anyone to think that you can lock out a virus by stopping Africans from traveling is completely unacceptable. Why is it that we are not seeing border closures from people from Belgium? Why is it we are not seeing border closures from people from Hong Kong? Why is it that the UK now that has identified the virus as well is not being closed from accessing Africa? It is unfair, it is racism and unacceptable. The same behavior we saw on vaccine supply being locked out from Africa is now we're seeing the same behavior of Africans being locked out from the world. It is unacceptable, it is not scientific, it is not supported by any measure, and should stop immediately.
And in fact, many have pointed out that, look, Europe is the epicenter of the pandemic right now, not Africa. And it is another point that many officials have said they are indebted to those scientists in Southern Africa and South Africa who identified this variant. I want to ask you, though, to get back to that point of vaccines. We just heard that despite vaccines being a reality now for almost a year, precious few Africans have even been offered their first dose. Do you think at this point that this still amounts to vaccine hoarding? And are you hopeful? Are you asking for there to be some massive worldwide effort to finally get vaccines to every corner of the globe?
It is absolutely pretentious for the world to assume that they're going to punish South Africa for actually sharing the code of a new variant in the world. On vaccines, we know that there is injustice. 17% of the world's people live in Africa. Only 2.8% of the total doses administered, which count to 7.9 billion, actually have been administered in Africa. And why? Because rich countries took to the front of the queue, booked all the doses, and therefore Africa has been unable to access the doses. And this is the reason we are asking, even us as Amref Health Africa, we are actually demanding through a petition that stockpiling must stop, and those countries holding doses should release them to mechanisms like COVAX or AVAT, the Africa Vaccines and a Task Team, so that the vaccines may be available to everybody equally and we protect the world. We cannot expect that we are going to lock out the virus by closing our doors and windows and living under the dome. It's not possible. Supply vaccines to Africa. Our petition demands release the stockpiles, stop the booster doses until everyone has a vaccine. Would you believe that total doses given to Africa are equivalent to total booster doses that are being given? It is injustice that we do not see the value of primary vaccination and we see more in value of booster shots. Let us increase production, let us share licenses, let us stop stockpiling, and let us limit the booster doses. That's our petition, and that's what we want the world to listen to, rather than blocking trade and blocking travel because a variant has been shared by a country, and yet that virus is across the world. What do we intend to achieve, Reed?
And I do want to point out the WHO has also said that boosters should have been, basically paused until the rest of the world could get at least one shot of the vaccine. I have to ask you, though, and Kenya, where you are, is a great example of this in terms of the challenges of even when you have the doses, what happens? There is a lack of infrastructure in Kenya. You've been hampered by few education campaigns. There's been a disappointing uptick. There is vaccine hesitancy. What do you think can be done? Because you know as well as I do that even where vaccines have been offered in Africa right now, hesitancy remains an issue.
The biggest hesitancy we've seen of vaccines in the world is in the US, not in Africa. In Africa now, we have had delayed vaccines. We cannot talk about hesitancy for something that's not available. The vaccines have not been available. In Kenya, as we speak, we have not got more than 10 million doses for close to 50 million people. So the supply is starting to ramp up, and therefore, and we know that people are queuing for vaccines. The challenge has been that people who went for vaccines early were told they were not available. People who are going for vaccines for their second dose are told, oh, now we don't have that one. We have this other one, so you have to go and wait. So there's no hesitancy. Let us not frame this as a demand issue. It is purely a supply issue. And as the vaccines become available, we are seeing that people are accepting them. Remember that the best ambassador for vaccine is somebody who's received it. So if no one has received it, then who is going to advocate for it?
Understood. Before I let you go, though, I do want to ask you, because there have been distribution issues. There are problems with the infrastructure. Do many countries in Africa need support with that as well?
Exactly. We know that even for childhood vaccines that we provide to under 5, there is huge support to countries to ensure that their vaccination campaigns, that we overcome all information and travel. People live far from health facilities. Some people live 50, 100 kilometers away. And this is the reason that we are demanding that universal health coverage is a priority, not only globally, but more specifically in Africa. We must invest in universal health coverage because universal health coverage assures us of access of health services to everybody. We have problems with children who have not accessed a single dose of vaccines, what we call zero-dose children. This is because of health infrastructure challenges. So the world must focus also on ensuring that everyone has universal health coverage, because you know what? If we do not protect people against access to health services through financial protection, then we are going to see multiple epidemics and pandemics starting because simply people could not access health services. So this is a priority. So we must make vaccines available. We must support vaccination, and we must have solidarity and stop behaving as if the virus is actually being generated by some countries and not others. We must treat the world equally and stop this pretentious behavior that by locking our borders against one country, that we are actually going to keep the virus away. We saw with Delta, you cannot keep the virus away. The best is let us vaccinate everyone so that we protect everyone.
Yeah, we definitely did see that with Delta. Mr. Gitahi, thank you so much for your perspective on this, an important one, especially as we see this new variant emerge. Appreciate it.
Thank you for having me. Thank you.